So today I am going to share certain insights about preventive health checkups and its necessity. By that time, the diseases progress. There are certain diseases which are in silent state and don't manifest any symptoms, such as Hello everybody, I am Dr.Suvarna Thakar. So today I am going to share certain insights about preventive health checkups and its necessity. Most of the diseases are manifested only when they develop symptoms. That is, a person goes to a clinic or hospital only when he has any complaints or symptoms are developed. By that time, the disease is progressed. Hence, the duration of the treatment and the recovery time both are increased. Also, there are certain diseases which are in silent state and don't manifest any symptoms, such as cancer, which can be very deadly diseases. Hence, the prognosis of the disease becomes very poor. However, there are certain diseases which can be diagnosed beforehand by regular health checkups. This can easily reduce our treatment duration. Also, the prognosis will be good of the disease, and if there are any future diseases which are going to occur, it will be diagnosed beforehand. Also, the recovery time will be faster. So, the regular health checkups which we undergo are extremely essential for each and every person, because disease does not see the status of the person. It does not discriminate between the age, sex, culture or occupation. It can occur in any form to any person. Hence, these regular health checkups are extremely essential. The duration of these health checkups vary from person to person, such as if a person is above 50 years of age, these health checkups are recommended at least once a year. If a person is under 50 years of age, these health checkups are recommended at least once in 2 years. If a person is suffering from any chronic disease such as diabetes, blood pressure or cancer, or has any family history of any of these diseases, then the duration of the health checkups will vary as per the advice of your doctor. Also, there are certain guidelines which need to be followed to undergo these health checkups, such as fasting period of 10 to 12 hours is required. If you are consuming any of the medications in your daily life, then you need to discuss it with your healthcare provider whether these medications need to be paused for a certain duration. Then also, 1 day prior to the test, caffeinated drinks, alcohol, smoking and fatty rich diet has to be avoided. You may also be asked to avoid application of creams, lotions or perfumes, powder if you have to undergo sonomammography or mammography. If there is stool examination, urine examination, pap smear examination for females, you may be advised to get these tests done prior to menstruation. You will be advised to undergo these tests 5 to 6 days after the menstrual cycle, even the sonomammography. Also, you may be advised to drink plenty of water prior to your sonography so that the sonography is appropriate and accurate. Now, these health checkups are divided into two sections. First is basic health checkup and second is some additional tests which are required as per the requirement of a person or a patient. So the basic health checkup includes two sections. One is investigations and one is general physical examination. Investigations include regular CBC, that gives your hemoglobin count and infection control count if it has any infection in your body. Then fasting blood sugar levels are done. Liver function test is done, which shows the status of your liver. Renal function test is done, which tells us the status of your kidneys. Then thyroid profile is done, which tells us the status of your thyroid if you're suffering from thyroid beforehand. Then also certain tests like lipid profile test is done to know the status of your cholesterol or triglycerides. Routine urine and stool examination is done. ECG is done to know the status of your heart. Chest X-ray is done to know the status of your lungs. Whole abdomen sonography is done to know the status of your abdomen, if there is any growth or pathology going on in your abdomen. Also, as per the age, stress test, that is a treadmill test or a 2D echo, will be decided. That is, if a patient is younger and can walk on treadmill, then a stress test will be done. If a patient is old and cannot walk on treadmill, then a 2D echo is done. Then there is second section is physical examination. In physical examination, your general vitals like your temperature, your pulse rate, your blood pressure, your oxygen level is measured. Then also your respiratory system is examined thoroughly. Your cardiovascular system is examined, that is your heart status is seen. Then per abdomen examined, that is it tells if there is any growth or pathology going on in your abdomen. Then general lymph nodes are examined to see if there is any growth, to rule out any infection status in your body. Then pedal edema, that is if there is leg swelling or swelling anywhere in your body, it is examined. Also, as per the symptoms of the patient, the local or the general system examination is also done. Then next is the additional examination. This will vary from patient to patient as per the requirement. If a patient is a known case of diabetes or blood pressure or cancer, there are specific risk assessment tests done for these to rule out cancers, that is cancer marker tests are done. Then for diabetes, special risk assessment tests are done, for blood pressure as well, to rule out if there is any pathology going on inside related to your heart. Also, these tests include, that is additional tests, your eye checkup, dental checkup, your BMI, that is to rule out if you're osteoporotic or no. Also, there are specific checkups for females and males as well. For males, there is PSA, that is prostate specific antigen, especially in males because their prostate growth is more common. Then in females, there is pap smear to rule out if there is cervical cancer. There is sonomammography or mammography to rule out if they are having breast cancer or no. Also, there are other tests included in these packages, that is additional packages as per, as I mentioned, the requirement of the patient. So all these checkups, if you do it beforehand, there are two main advantages. One is the disease is diagnosed beforehand to reduce the treatment duration and the recovery time as well, and the prognosis is good. Second is to prevent if there is going to be any future illness by modifying your lifestyle if it is required. Especially if there are changes in your lipid profile, then you can modify your lifestyle and avoid those changes to be occurred. So I think most of the things are cleared, and I hope you will be undergoing your regular health checkups. Thank you and have a nice day.